One of the most difficult parts of dealing with an HIE diagnosis is going to be that uncertainty is what's going to come next. And when I speak with mothers, a question that comes up frequently is going to be whether an HIE brain injury, whether their baby's brain injury is going to lead them to suffer seizures in the future. And it's a question that is real, and there's a lot of fear with it, and there's a lot of concern, and it deserves a direct and honest discussion. And we're going to talk about that today. And so when we're talking about HIE, it's important to remember that we're talking about a range here. The impact on a child's brain is going to depend heavily on the severity of that initial injury. And in the cases that I look at and I examine, the extent of the injury is frequently tied to whether or not the baby develops seizures. Generally speaking, the babies who have been diagnosed with a moderate to a severe HIE brain injury, those are going to be the ones who commonly will develop seizure activity. And in those cases, the injury to the brain tissue is more significant, which can disrupt the normal electrical signals that the brain is sending out. On the other hand, in many of the cases that are mild that we see, those babies may not develop seizures at all. The brain is often able to compensate more effectively when that initial insult was less severe. But I want to be clear with one thing about this. I'm talking about this in general terms based on the patterns that I see and the records that I look at. In medicine, especially when we are discussing the brain, there is no absolute certainty with it. Every baby is an individual, and every baby's brain is going to respond differently to something like this. And so while the severity, it can help give us a guide, it's not a guaranteed roadmap. And I think that this also leads us to another important reality. For the children who do develop seizures, the duration and the frequency, it can vary widely with this. For some of these, they may be neonatal seizures that occur shortly after birth, and then they may subside. And for others, managing seizures, it can be longer. It can be a long-term challenge with ongoing care. And because of all of this variety, the most important thing that you can do as a parent is you got to remain vigilant. You're the person who's spending the most time with your child. You are the one who will notice the small things in your infant. You can see, seizures, because they're not always going to be obvious. They can look like subtle eye movements. They can look like repetitive lip smacking or any other types of unusual movements of the arms or of the legs. And if your child has been prescribed medication to manage these issues, I understand that following that regimen, it can be incredibly difficult. There may be side effects at times when the medication when the medication can create new challenges for you and your baby. And while it's vital to keep the brain's electrical activity as stable as possible, you should never feel like that you have to navigate this stuff by yourself. If you're struggling with the medication or you're noticing changes that worry you, please, you need to bring those concerns up to your child's doctors and neurology team so they can know. They're going to need your feedback to be able to ensure that the treatment plan is actually working and that your child's specific needs are being met with all of this. So again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury at birth or a subsequent CP or cerebral palsy diagnosis from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile. My information is there. If you're watching this video on certain apps, you can DM me and we can chat a little bit about your baby story, or you can just wait and watch the picture that follows the end of this video. All right, that's going to be it for this morning's quick educational video. Take care and enjoy the rest of your weekend.